This impacts millions of Americans, and there are certain ailments that can happen when it comes to your feet.
Definitely. One thing that we recommend doing for a lot of people who have diabetes is checking their feet regularly. The importance of that is if you have diabetes, you are more likely to injure your foot. And the reasons for that include that you will develop something called neuropathy. What that means is you are not able to sense any injuries to the foot. Okay? So if you are wearing shoes that are a little tight, if you have a little bit of a rock in them, they would affect it and injure you. The other thing is your body's immune system becomes a little weaker when you have diabetes. So you have the infections that are growing and your body can't fight it as fast. And you have also decreased blood supply going to that area. So these things make it a little bit harder and more difficult to treat. So if you manage your foot and have a daily assessment of it, you can catch infections or injuries a lot earlier and have taken care of them. So it's more preventative than reactive in that case.
So are there certain shoes that someone should look for that will maybe take better care of their feet?
Yeah. There are actually a lot of organizations out there that will provide you diabetic foot special shoes. They should be at least half an inch longer and a little thicker than you normally would wear. Should be comfortable, but you should see specialty clinics that do this for. That is what their business is, and those shoes would be good for anybody who has diabetes.
And now, if someone has questions about management or care, who do they turn to get some information?
Definitely their primary care doctor. Those would be the best places to start, especially if they have diabetes. They should have regular follow-ups and checks with them, and that would be a good place.
Okay. All right. Wonderful. Thank you so much. Great information today.
Thank you for having me.
And we will be right back with a final look at your forecast.